Shoulder impingement syndrome is a painful condition that results from wear and tear problems with the shoulder or from performing repetitive overhead motions. Shoulder impingement syndrome usually results from a muscle imbalance around the shoulder that places stress on the rotator cuff tendons. The condition develops when the tendons and bursa, a fluid-filled sac that lubricates the rotator cuff tendons, allowing for smooth, painless motions, are rubbed and pinched, usually in the normal course of life, causing degeneration, irritation, and inflammation. Degeneration and inflammation can cause tendons to tear or detach. As a result of shoulder impingement syndrome, abnormal growths called bone spurs can make the space beneath the bone too small for the rotator cuff tendons. The space may also become too narrow because of thickened tissues or other structural or mechanical abnormalities. Shoulder impingement syndrome causes pain in the shoulder and upper arm. You may have difficulty moving your arm. It may feel weak and painful when you raise or lower it. Night pain may interfere with your sleep. For some people, symptoms are relieved with avoidance of certain activities, medication, and therapy. Arthroscopic surgery is recommended when such treatments provide minimal or no improvement. Arthroscopic surgery uses an arthroscope to reconstruct or remove damaged tendons, tissue, and bone. An arthroscope is a thin instrument with a camera that's inserted into the shoulder joint through small incisions. It allows surgeons to see, diagnose, and treat shoulder problems without opening up the joint or disturbing surrounding tissues. Because it is less invasive, arthroscopy has a decreased risk of infection and generally a shorter recovery period than traditional surgeries. Let's take a look at arthroscopic shoulder surgery. To begin, several small incisions are made. Next, the joint space is expanded with a sterile saline solution. The arthroscope is inserted. It may be repositioned to view the joint from different angles. Damaged tendon is trimmed, and bursa and bone spurs are removed with thin surgical instruments. Because the incisions are so small, they simply require just a stitch or steri-strip and are covered with a bandage. Following surgery, therapists will gently help you move your arm at first, and then you will progress to strengthening exercises. Your shoulder will need several weeks to heal. Your recovery will depend on the extent of your condition and the extent of the surgery that you had. Your doctor will let you know what to expect. Most people achieve good results with shoulder arthroscopy for impingement syndrome.